It is M123 FM and the Newberry News. We are visiting with Luce County EMS's Joe Smithson. And Joe, thanks for joining us. And how are things going? Been a busy time out in the community.
Yeah, it has, Dan. It's been pretty busy. Lots of fun though with the 4th of July festivities. Being out in the public's eye and just kind of getting to know some of the community members. We've been pretty busy, like you said. We had an open house recently. Yeah. We talked about that previously with you and with Steve. That went well. We didn't have a great big turnout, but it was the first time we've ever done anything like that. And I was encouraged by the folks that did show up and ask questions and got a chance to see our facilities and our equipment and meet our staff. We are going to host another one. I think we're working on August, maybe a little sooner. That's in the works. But also we want to do one out in the Lakefield community because we want to touch base with those folks as well. They're very important to us. And the parade, we were in the parade. One of the things that I was doing in the parade and a couple of our staff was handing out some information, some flyers to talk about the millage that we're going to ask the taxpayers to increase for us. It's a super important situation for us. We really need to increase our revenue so that we can afford some new equipment. One of the things that folks probably that showed up at our open house did see was how old our equipment's getting. We just haven't been able to afford to purchase new ambulances. And obviously we need those to do the work we do. One of the things that they probably noticed was the incredible amount of miles we put on these things. A couple of our rigs have, close to 300,000 miles on them, and we really need to look at getting those replaced with stuff that that's more reliable.
There's some rigs that you've basically had to take off of the road.
There is actually in our fleet. There's one that we've just decided to leave in the garage and only use in. I use the term relative, but in emergency situations, because it is so old that anytime we roll it out of the garage, it seems to break down. It's just worn out.
Yeah.
And so we haven't taken it out of service per se, but it's going to be our last rig out the door, and only use it if we absolutely need to. Of course, we're going to use it if we need to in mass casualty situations and things like that. But we want to. We want to keep that maintenance bill as low as we can on that thing because it is starting to nickel and dime us.
And it doesn't do any good if you're trying to transport somebody safely to an emergency medical facility if you break down on the way to a scene or in transport. Doesn't really do anybody any good.
That's precisely it, Dan. I mean, and that's unfortunately that has happened. We have had rigs break down in transit from here to other facilities in our area, say Marquette or Petoskey or even further facilities. It hasn't happened with a patient on board yet. It's usually just stranded my staff, but we don't want that to happen. I mean, obviously, when we are going from Newberry to another facility, we got to get those patients there because they're in critical need of something. And again, it hasn't happened at that level yet. But I found myself at 2:00 in the morning getting a call from my staff saying, "Hey, the rig broke down. Can you come and get me?" So we're calling a tow truck to get our ambulance, and I'm going wherever they're at to pick them up. So that's the kind of situation we're in right now.
Let's go back to the community outreach part, because nobody wants to find themselves or hopes to find themselves in the back of an ambulance. Right. But when that time comes, they're relying on you for their safety, for their friends and family's safety. Yeah. But how important is it to get out and get engaged in the community so you can build that relationship with people? Because typically you're coming across people at a very stressful time.
Precisely.
And I would feel, I just know from my personal experience, it feels a lot better having people that I know.
Yes.
and trust in the community serving in such a big time of need.
I think you hit it right on the head, Dan. I think it's the trust and it's the relationship, the rapport that we need to build. I think is absolutely vital to the longevity and the future of our organization. It's getting to know people when you're not in an emergency situation, and I think that's so important for us. It's something that we've not done much of, and that's something that we're trying to turn that corner, and we really want to do that. And having these community events gives the opportunity for people to see us, me, my staff, which are top-notch Class A staff. I mean, we have the best medics around, we really do. And it gives people an opportunity to see them on a more personal basis, without the emergency situation. Because you're right, when people call 911, it's usually because it's at one of the worst times or moments in their life, and they need us to do things that, we're not able to sit and chat with them.
Yeah.
We're focused, they're focused, we're trying to make a bad situation better. But getting out and talking to folks, building that trust, building the relationship, letting folks know that, we're all human too. We have families and friends, and we care about them, and we want them to care about us. It's vitally important, and we really want to start doing more of that.
Rural EMS units all around, not just here locally in Newberry, but really probably across the state, are faced with a lot of the same challenges. But a couple of unique ones here. I think first off, got to talk about the size of the service area.
Yeah.
I don't know if there's an EMS unit that has to cover more miles than us.
I could be wrong. I think I'm right, but don't quote me on this. But I believe that we have probably the biggest coverage area in terms of Luce County in the state of Michigan. Now, I mean, I say that maybe haphazardly. If we're not the biggest, we're one of the biggest, because we do cover Luce County. We don't just cover Newberry, the entire county, which is, I don't know if it's 800 square miles or what it is, but it's humongous. So we find ourselves not only covering calls locally in the village, but we are also, like I said, out in Lakefield or Columbus Township, out on County Road 500 up by Lake Superior. We really do cover a lot, and we also have extra jurisdictional contracts that we cover as well, because, like you said, these smaller areas, they don't have an ambulance service. This is something that we got into years ago, and we've continued to do that, and it's more and more difficult with skeletons, staff crews and stuff like that. But when they call, you can't say no. I mean, you can't say no to folks when they need emergency care.
Yeah. And there might be nights where you run to Lakefield and back, and then you run to Deer Park and back, and then you're running to over by Holbert and back.
That's true.
So you're zigzagging across a lot of miles, and then what you mentioned, Newberry and Helen Newberry Joy is the closest medical facility for places like Curtis, Engadine, Novenway, some of these other rural communities that may be just outside the county, but this is the closest place to go for healthcare, and you guys got to step in.
That's precisely it. We do what we do because we love what we do.
Yeah.
And when people need us, they need us now. And you're right. State law dictates that when we go to a scene and pick someone up, whether they're sick or injured, we have to bring them to the closest medical facility that's appropriate for them. And right now in our area, Helen Newberry Joy is it. They're a great partner to us. They are fantastic. We work together very well. We're on the same page on everything we do. But yeah, that's it. When we go to Holbert, Deer Park, Curtis, or whatever, and Curtis has their own ambulance service. They have the Portage Township EMS, fantastic service. Garfield over in Engadine, they have theirs, another fantastic service. We're all ALS, Advanced Life Support Services, and we rely heavily on each other because of the staff shortages right now. And we bring everybody to Newberry because it's the closest appropriate place. And that puts a lot of pressure on Helen Joy as well.
Obviously, another problem is staffing. I know there's some things that you're hoping to do and work with, and we'll talk about that hopefully a little bit more down the road. But let's talk about the millage, because unfortunately, as we're seeing everywhere in our lives, the cost of maintaining things is going up. And you mentioned some of the maintenance challenges, some of the different obstacles in the way. But going to the community and asking for their help so you can help them. Tell us a little bit about what we may see coming up with the millage.
The millage it's a complicated system, if you will. I mean, it really is. And unless you're involved in it and you look at it and study it, and unless you're really asking, going into the taxpayers and asking for it, it's hard to understand. And even some of the taxpayers probably don't quite understand exactly how that all works. So the community, the taxpayers in Luce County have always supported us. They've always been extremely supportive. Ever since I've been there at Luce County Ambulance Service, we've always had a 1 mil approval from the taxpayers. And I don't know when that started. I haven't really. It was way before my time, but it's always been there. In 2018, we thought, we need to look at things and possibly go back and ask the taxpayers for more because of things like the maintenance challenges and the staffing challenges and all these things. Building maintenance too. That's another big one. So we went back. We did what we could. We got approved by the commissioners here locally to ask the taxpayers and be on the ballot, and it was approved. The taxpayers approved it again without question. Really, I mean, they gave us another $500,000. So that was 2018. Fast forward just a little bit. Nobody could foresee this. But then the pandemic happened. Yeah. COVID was hard on all of us, everybody, not just emergency services. Yeah. Every single industry out there, it was different. It's still challenging for everybody. We've estimated that during the pandemic, and of course you can't, in terms of causation or correlation or whatever, you can't say specifically this is what happened to us. The pandemic caused this, but during the pandemic era, if you will, we estimate we lost around $200,000 in run revenue. Okay. And for a smaller organization like us, $200,000 is difficult to make up. Yeah. I mean, that's 15-20% of our annual revenue. So, we're supported by the taxpayers, and we're very gracious for that. We're also supported by our own run revenue, and in combination, those two revenue sources are what keeps us afloat. So that $200,000 hit, if you will, we haven't been able to make that up. And an average ambulance cost right now for a brand new ambulance, you're looking at being anywhere between $250,000 and $300,000. So right there would be that would be a huge thing for us if we were to find that somewhere, but we're not going to find it. So right now we're going back and asking in incremental steps. This was by the advice of our legal counsel and all kinds of input from different entities. We're going to ask for basically the taxpayers to double our millage, but in incremental steps. Okay. In November, we're going to ask for the taxpayers will see this on the ballot language, but we're going to ask to replace that $500,000, the $500,000 that was in 2018, with a complete 1 mil. So we're replacing that, and if we do that, then we will be up to 2 mils. Okay. And this was explained in that paper that we were handing out at the parade and things like that. And I hope I'm not misspeaking. I think I got this right. Like I said, it's very complicated, but essentially at the end of this process, we're hoping that in another year or two's time, we don't quite know yet. We're gonna kind of evaluate this as we go. We're hoping that the other mill we can replace with whatever was left to bring us to a total of 3. And we feel very comfortable with 3 mills being able to support our maintenance costs, our equipment costs, and our staffing costs. And if we can do that, I think we'll be back on track. And nothing's saying that the millages have to be forever. We do this to support, to support our revenue, our run revenue, until we can be more comfortable. And hopefully this isn't forever. Hopefully we can go back to the taxpayers someday and say, we don't need that anymore. We only need, X amount. Maybe we only go back to 1 or 1.5. But that's the thinking right now. And hopefully we can get there.
Always have to ask when it comes to millages, what happens if it doesn't?
If it doesn't pass, it's a scary prospect. I don't have all the answers to that, but I think if it doesn't pass,
certainly going to have to reevaluate.
Yeah, definitely reevaluate. My initial response would be, we'll be running some old rigs, and our money will be being put into repairs and maintenance instead of being able to put those elsewhere, like in building maintenance and things like that. I mean, if we don't do something with specifically the ambulances right now, we will be in a little bit of trouble. We'll just have to keep patching them up and keeping them on the road. However, one of the signs that was in one of the windows of the rigs at the open house, I put a 3-year average annual cost for maintenance on that, and it's costing us right around $18,000 to $19,000 for just that ambulance, just to keep it on the road. So we really prefer to not do that, and I'm sure the taxpayers prefer us not to do that. Like you said, it comes down to safety and security. When we take someone from Newberry to another facility, or when we go pick up someone in the community, they and we want to be sure that we're going to get from point A to point B. We don't want to have to worry about the rig breaking down and things like that. So if it doesn't pass, we have to reevaluate things, and the board and I will talk about that at the time comes. But really looking forward to the continued support from the community.
If you want more information, you can follow along. We'll have updates coming up in the Newberry News, and Joe will be back throughout the lead up to the millage, giving us more updates and information. With Joe Smithson and Luce County EMS, I'm Dan Hardenbrook. It's M123 FM in the Newberry News.